And I'm Maggie McGrath, editor of ForbesWomen. There is a $100 million plan to restore abortion rights in the United States. And here to explain that plan is Kimberly Inez McGuire. She is the executive director for URGE, Unite for Reproductive and Gender Equity. Kimberly, thank you so much for joining us.
Thank you so much for having me. I'm really excited to talk about abortion access.
So, what is this $100 million campaign? Where did the money come from?
Yeah, so this campaign, Abortion Access Now, is being supported by 9 executive committee organizations, half of which are reproductive justice organizations, and the majority of which are led by women of color. So every single one of these organizations has been raising funds. We are also raising funds as a collective. And the goal is to put those resources towards a massive effort to restore abortion access with a specific focus on federal policy. What we have seen in the last 2 years, the chaos created by Dobbs, we are going state by state with abortion bans, with Supreme Court cases that are forcing us to consider how many organs have to fail in a woman's body before she can get emergency care. I mean, there's confusion. People are traveling thousands of miles. It's unacceptable. The only way to restore some degree of access to this country is to have a federal law that makes abortion legal and accessible everywhere.
So this $100 million, are you breaking it down state by state? So campaigners in Texas will get some, campaigners in Alabama will get some, or is it all going towards lobbying the federal government?
So those resources are going to be invested by all of the participating organizations in a variety of ways. So, for example, URGE, we are one of the executive committee organizations. Our part of the work includes both the collective work, lobbying, talking to folks on Capitol Hill, building the political will for a broad abortion access agenda. That also includes the work that we are doing in places like Alabama and Georgia and Kansas and Ohio to protect and maintain abortion access wherever we have it and to stop abortion bans wherever we can.
So you have referenced the last 2 years. Obviously, this past week, we marked the second anniversary of the Dobbs decision, which overturned Roe v. Wade. You have been working for the last 2 years to help people in states with abortion bans. How does this campaign differ from the work that you have already been doing?
Yeah, so when I think about what has happened since Dobbs, right? And folks all over this country have been working so hard to fill the massive gaps and really the crisis that was created, right? I mean, the incredible work done by abortion funds all over this country, getting people to their abortions, often, traveling hundreds or thousands of miles. The work that clinics have done in states where abortion isn't banned in bringing folks into their state to get care. And then there's been the ballot initiatives, right? And URGE is really proud to have co-led 2 of the 7 winning ballot initiatives for abortion access. So much of what we've all been doing across the country for 2 years has been addressing the crisis, getting people their abortions, keeping abortion on the table in as many states as we can, because we think about states like Ohio that are an access point for the Midwest. We think about states like Florida that are, we want to keep as an access point for the South, right? All of that's hugely important. Here's what's different. We are now looking at the possibility, right, that after this election, there might be a trifecta that is supportive of abortion rights. If that happens, it will only be because of the issue of abortion. The issue of abortion is what is motivating people all over this country. And if that happens, those elected officials need to know exactly what it means to deliver on abortion access and to stop the crisis. And so what this campaign is doing that is different is folks are already mad. They don't need our help to get mad, right? But what we're doing is to try to galvanize that anger into a clear demand for federal policy. This cannot be a state by state issue. We need a federal law that makes abortion legal and accessible everywhere.